What's up guys, and welcome back to the channel. And today's video we're going to be talking about something near and dear to my heart, the ICU, and specifically what are some of the things, medications, technologies, and equipment that you might find in the ICU in the hospital setting. So let's get started. The ICU is a very complex setting in the hospital, and if one medication stops or an equipment malfunctions, a patient could decompensate or even die. So first and foremost, I want to play this clip that is a pretty good representation of what an ICU room might look like in the hospital. And again, this might be overkill. It might show a little bit of the maximum level of detail and equipment and medications that you might see. But again, it's going to be a very frequent and common scene that you might see these medications and drips in the hospital. Okay, so first and foremost, you might have noticed that on kind of this left side, you have a big rack of like IV poles and channels and brains, and extremely high equivalent of medications, including probably cardiac medications, propofol, sedation, pressors. These are all medications to help keep the patient's blood pressure and keep them adequately sedated while their breathing on the ventilator, and that way that the lungs can kind of rest and heal. Now specifically, I want to talk about the infusion pump that you just saw on that right side. There's probably like 1, 2, 3, probably like 6 to 8, even 12 continuous drips in that patient. That's quite a lot. But again, it's very potentially common that you might see that in the ICU setting. Now, some of these infusions are going to be continuous. They're going to be sedation related, like propofol or fentanyl or Dilaudid. You might also have some continuous cardiac medications like Levophed, norepinephrine, dopamine, epi, stuff like that, that basically, will keep the blood pressure at a stable rate. It'll keep the heart rate at a stable rate. And then you might also have, more non-continuous drips like antibiotics that are going every 30 minutes or every 4 hours. You might also have like, potassium infusions to supplement different electrolytes that are out of whack. So, in a patient who's really critically ill, you can see a lot of drips. And again, the nurse is going to be the one at the bedside, and they need to be on their A game to kind of make sure that these drips don't run out and that they're titrating these adequately. Now, when it comes to the ICU setting, one of the most important things that we're going to have patients on at all times is frequent cardiac monitoring and other forms of essentially assessing the patient's vital signs. This could be, arterial lines. This could be different dialysis, so that we're going to see their fluid removal rates and all that. So we're going to have the patient on a lot of machines and monitors to see any type of change that we can act on appropriately. Now, the most frequent monitor is going to be a simple, ECG monitor that has the patient's heart rate. It's going to have the specific rhythm that they're in. It's going to have their pulse rate. It's also going to have their blood pressure. It also is going to have their oxygen saturation. If they have more in-depth monitoring, like a Swan-Ganz catheter, it can also measure their cardiac index, their cardiac output, stuff like that. Indirect measures of the patient's heart, pulmonary artery wedge pressure, stuff like that. And basically, this is the vital signs. This is the window into the patient and how well or how sick they're doing. And then that way we can adjust the parameters or the medications as necessary if the patient is dropping their vital signs. Now, the next thing that I noticed in the clip, and I'll show it again here, is going to be stuff like lines, drains, chest tubes. So on the bottom there, on the floor, you could see the patient had like a chest tube going down to the floor. So the ICU setting can get very, very busy with all these different lines and drains. And this is a good example of a chest tube that the patient has on the floor there. Okay, and right next to that chest tube, you might have seen it. It's going to be the Foley catheter. That is very, very adequately necessary to monitor the patient's urine output, make sure that the kidneys are working, and also just to collect the urine while the patient is so critically ill. Okay, next, and something that you definitely are gonna see in the ICU setting are going to be ventilators. Ventilators are gonna be the lifeline for patients who are having respiratory complications. This could be a really bad pneumonia. It could be a virus like tuberculosis or an Ebola or coronavirus or influenza, something like that. It could also be for more surgical type procedures. Sometimes they will actually put the patient on the ventilator during a surgical procedure, like a cardiac procedure or liver or anything like that. And that's simply so that we can give the patient that anesthesia that they need to go under the needle. Now, something super important that may not be talked about as much as well is the type of bed that you're gonna find in the ICU. And these are very, very smart beds that help reduce pressure on the patient's skin. They're also gonna allow the patient to switch position, elevate the head of the bed if they're having issues with aspiration or swallowing. You're also gonna have some beds that have the ability to actually, turn themselves and do side to side turns. And then even in higher level institutions, I've seen beds that you can actually flip them fully over like 180 degrees and it will actually prone the patient. But this is gonna be a much more luxury type bed. Now, other devices that you might find are gonna be more specific to different body systems and different organs. So for example, on that clip at the very end, you can see that they have a kind of like purple white device. That's going to be a bedside dialysis device. It's known as CRRT, continuous renal replacement therapy. And again, it just as the rooms and the patients get more sick and sick, the rooms get smaller and smaller because the devices that we need to support the different organs continue to add up. Now, the dialysis machine is a device that essentially filters out the patient's kidneys and filters out the blood when the kidneys are no longer able to do so. It helps remove toxins and waste and kind of put the electrolytes in a much more narrow and tight range where the patient can heal and the kidneys can recover faster. Okay, in the middle on the back of the bed here, this is a device known as a balloon pump. Again, talking about body systems, this is a device that's gonna support the cardiac system and specifically the left ventricle. What this device does is a balloon mechanism that opens and closes and sucks blood in and pushes blood out to the rest of the body. And this is gonna be for patients who are going to be going into severe heart failure where they might need a heart transplant. Now, right to the left of that IV pole, that was a cardioverter defibrillator. So that's going to be in a situation where they're really scared that the patient is going to code or lose a pulse. So they might put these pads and that device on the patient that if they do go into like a VTAC or like an asystole, that they can actually shock the patient and hopefully bring them back to life. So again, basically the ICU setting, we're essentially trying to, make the patient as stable as possible and essentially buy time so that these organs can recover or they can get the life-saving surgical intervention that this patient desperately needs. So as the patient gets better, again, we hope that we can start to see some of these machines taper off. We can start to, wean down the support. Maybe now they need less oxygen from the ventilator. Eventually, maybe we can get the breathing tube out and we can take them off the ventilator altogether. Next progression might be that they no longer need this balloon pump. Maybe they went to surgery, they got their issue fixed. The heart's working again, or they got a heart transplant or a valve replacement. Now they no longer need that balloon pump. Maybe the kidneys are starting to heal again with the heart working better. The heart's going to be pumping more blood to the kidneys. The kidneys have recovered. The creatinine is kind of coming down. So now the dialysis machine is coming off and they don't need dialysis anymore. Maybe, again, the heart, the body works in amazing ways. It all works together. But now with all that, change that I just talked about, maybe the infusion pumps are getting less and less. Maybe they don't need as much epinephrine or dopamine or any of these, cardiac stimulator medications. Obviously, if they're not on the ventilator, they don't even need any more propofol or fentanyl or Dilaudid. So it's definitely a progression, but I've seen that as we can kind of taper off one machine, oftentimes other machines subsequently will come off as well. And that's, the goal at the end of the day. Now, something that I think was really interesting is the caption of that video was, your nurse is busy if they say that they're one-on-one. Yes, so this patient is extremely critically ill. However, you know, due to short staffing across the nation, I think that that's an assignment where you potentially might even have another patient and have up to 2 patients, which is crazy. Yes, I know. But at the same time, that's where that critical thinking and that time management comes into play, where you have to manage all these things in your one room, but then you might have another patient who may not be quite as sick, but that you still have to address that patient and, you know, get them the things and the medications that they need as well. And that's it. I hope you enjoyed the video. It was just a little bit of a taste into what you might see in the ICU with some of these, you know, drips and some of these technologies and devices. And again, every hospital is different. That was not my video. It was just something that was, you know, streaming around on the internet. And I thought it was pretty interesting because, again, it was a pretty critically ill patient. There was a lot of stuff going on. But having an understanding of the fact that those are, you know, definitely things that you're going to see on your patient when you start in ICU, and getting familiar with, you know, the different forms of life support, whether it be, you know, cardiac support, you know, dialysis, respiratory with the ventilator and all that. And essentially, you know, having a good grasp on what you might walk into on a daily basis and how to adequately titrate and manage that device is critical to develop and provide the best care to your patient. Also, thank you so much for 300 subscribers. Really means a lot. I started with literally 0 about maybe a couple weeks ago. And so this channel, you know, is still small, but we're trying to, you know, grow it a little bit. And I really appreciate the support. And I'll see you back in the next one. Adios.